Welcome to this Chemscape presentation on insect bites and stings. Every year, thousands of workers are stung or bitten by insects on the job. For most, it is a painful inconvenience. For some, it can be life-threatening. This presentation will review how to recognize the difference between a minor reaction and a medical emergency. Here are common insects you may encounter at work sites across North America that can bite or sting workers. Bites from wasps and hornets. Fire ants and ticks can have worse outcomes and reactions. Honeybee stings can be serious for people with allergies to them. Mosquitoes, horseflies, deerflies, and blackflies can deliver nuisance bites, but some individuals can experience severe reactions as well. Most insect bites cause a local reaction, some redness, swelling, and itching. This is normal and manageable. However, for some people, a single sting can trigger anaphylaxis, a life-threatening allergic emergency. It is critical that you know the difference between a normal reaction and a severe one. A normal reaction is the body's mild, natural response to a bite or sting. Symptoms include redness, swelling, and itching at the bite site that resolves within hours to 2 days. Provide basic first aid, then monitor for 30 minutes to confirm the reaction does not progress. A more significant reaction is when swelling extends well beyond the bite site. For example, an entire arm or leg becoming swollen rather than just the area around the sting. This type of reaction persists longer, typically between 2 and 5 days. While not immediately life-threatening, this reaction requires closer attention. Have the reaction checked at a medical clinic. Anaphylaxis is the most severe allergic reaction a worker can experience, and it is a life-threatening medical emergency. Unlike the other reaction types, anaphylaxis affects the entire body and can escalate rapidly within minutes of a bite or sting. Signs and symptoms go far beyond the bite site. Watch for hives spreading across the body, swelling of the throat or tongue, difficulty breathing, wheezing, dizziness, a sudden drop in blood pressure, and in the most severe cases, loss of consciousness. If you observe any combination of these symptoms following a sting, act immediately. Call 911 without hesitation. Do not wait to see if symptoms improve on their own. They will not. If the worker has a prescribed epinephrine auto-injector, administer it to the outer thighs straight away and continue monitoring until emergency services arrive. Every second counts. Does anyone at your work site have a known anaphylaxis allergy? Are coworkers aware of where the EpiPen is kept and understand how to use it? Because in an anaphylactic emergency, there is no time to waste. While a mosquito bite may seem like a minor nuisance, it carries its own risk: the potential transmission of disease. The two most significant diseases associated with mosquito bites are West Nile virus and malaria. West Nile virus is present in North America. Most people infected will experience mild flu-like symptoms, but in some cases it can lead to serious neurological illness. Malaria is a risk in tropical and subtropical regions caused by a parasite transmitted through the bite of an infected mosquito and requires prompt medical treatment if contracted. Understand the mosquito-borne disease risks specific to your area before work begins. If you develop fever, chills, fatigue, or flu-like symptoms following work in a mosquito-prone area, seek medical attention promptly. Early treatment makes a significant difference in outcomes. Ticks are a hazard on many work sites across North America, and their range is expanding every year as temperatures rise. Ticks have been found in every province and the majority of states, so no region should be considered completely free of risk. Ticks are most likely to be found in tall grass and brush, wooded or forested areas, leaf litter, and anywhere wildlife such as deer or rodents are present. They tend to gather along the edges where open land meets tree cover, exactly the kind of terrain people move through regularly. Ticks are small and their bites are painless, which makes them easy to miss. After a tick latches on, the bite area may appear as a small red bump, similar to a mosquito bite. The tick itself may still be attached and visible as a small dark speck on the skin. Check yourself carefully, paying close attention to hidden areas like behind the knees, the scalp, armpits, and around the waistband. The sooner you find a tick, the better. If you find a tick on your skin, do not panic, but act quickly. The longer a tick stays attached, the greater the risk of disease transmission. You can remove a tick with a fine-tipped tweezer and grasp the tick as close to the skin surface as possible. Pull upward with slow, steady pressure. Do not twist, jerk, or squeeze the body of the tick. Once removed, clean the bite area thoroughly with antiseptic or soap and water. Once a tick has been removed, monitor for signs of Lyme disease 3 to 30 days after a bite. The most well-known early sign is a bullseye. Not everyone develops this rash, so do not rely on it alone as your only warning sign. Flu-like symptoms appearing days or weeks after a tick bite should be reported and assessed by a medical professional. Lyme disease is a bacterial infection transmitted through the bite of an infected tick. Left untreated, it can have serious long-term effects on your health. If Lyme disease is left undetected or untreated, symptoms can progress to include severe joint pain and swelling, neurological problems such as numbness or difficulty concentrating, and in some cases, heart complications. Early treatment makes a significant difference in recovery. Follow the hierarchy of controls to make your work environment unattractive to pests. A combination of controls may be needed. Remove the hazard where possible. Identify and eliminate insect nests on or near the work site before work begins. Engage licensed pest control for nest removal. Substitute for lower-risk alternatives if feasible. Reroute footpaths away from known nest locations or wooded tick habitats. Use treated or enclosed work shelters instead of open-air stations. Install physical barriers such as insect screens on site buildings and rest areas. Ensure there is no stagnant water on site to reduce mosquito breeding grounds. Regularly inspect your work site. Report swarms or nests you encounter to your supervisor. Keep a clean workplace to detract pests from establishing nests and breeding grounds. Let your supervisor know if you have allergies. Have an antidote, like antihistamine, ready. Back up other controls with personal protective equipment. Wear long-sleeved shirts and pants in light colors. Tuck trousers into socks. Use insect repellent containing DEET or Icaridin. Knowing how to respond immediately after a sting or bite can make a significant difference in the outcome. Here are the step-by-step first aid procedures. Site supervisors and designated first aiders need to be familiar with these steps and able to act without hesitation. Here is some general bite or sting protocol. If you are bitten, move to safety to prevent further stings. Remove the stinger or tick. Wash the area with soap and water. Apply a cold compress for 10 minutes to reduce swelling and relieve pain. Administer medication for pain relief and to reduce swelling if needed. Monitor for any sign of an escalating reaction. Recognize the risk of insects and their bites in your work areas. Understand allergy risk and know the signs of anaphylaxis. Apply the hierarchy of controls to minimize exposure, follow the correct first aid steps, and ensure everyone on site has their training up to date. If you have any questions or concerns, raise them with your supervisor.